This video is especially dedicated to men aged 50 and above, as we will be discussing erectile dysfunction in aging males. It's important to note that medical information on the internet can often be inaccurate and misleading, particularly regarding sexual health, as much of it is provided by non-professionals. I've seen a bunch of videos on internet that says, do this and eat this, drink this and that, and your erectile dysfunction will go away. It's not that simple, and sometimes it will help them, and most of the time it doesn't. And of course, the ideal situation would be to find the root cause and correct that. As men age, various factors can contribute to the development of erectile dysfunction. So understanding these causes can help in managing and possibly preventing ED. So, if you're a man over 50 watching this, I want to reassure you that there is still hope. You don't have to silently accept the erectile dysfunction. I'm here to help you overcome them and thrive. First, let's talk about physiological changes. As men get older, their bodies naturally undergo several changes that impacts sexual function directly. Number 1. Decreased blood flow. One major factor is decreased blood flow. As we age, our arteries can harden and narrow, reducing blood flow to various parts of the body, including the penis. This reduced blood flow makes it more difficult to achieve and maintain an erection. Another significant factor is hormonal changes. Testosterone, the primary male sex hormone, tends to decline with age. Lower testosterone levels can lead to a reduced libido and difficulties with erections. Furthermore, nerve function can also deteriorate over time. Conditions like diabetes and other nerve-related issues are more common in older men, affecting the nerves that play a vital role in erections. According to a study, 14 to 60% men in their 50s are experiencing difficulties in achieving stronger erections. Generally, beta receptors facilitate smooth muscle relaxation in the corpora cavernosa. Problem is that the number of beta receptors decreases as we get older. On the other side, the influence of alpha receptors increases. One can roughly describe that influence as a tightening of tissues so that it becomes even more difficult for the blood to enter the penis. As a result, erection is developing less and less swiftly as we get older. And you all know, at the same time, the period between two erections after ejaculation increases. It is entirely normal that erection ends after ejaculation. The time needed for the penis to be able to erect for the second time is called the refractory period. And remember the good old days? When you were in your 20s, you were able to ejaculate and get erections several times a day, but now, it may take days and even weeks for a 60 or 70-year-old man to be able to erection again. Another thing is low libido during the 6th decade of life. It has been seen that the levels of testosterone also decreases in many men as they grow older. From the age of 40, men lose approximately 1% per year. In some men, this can lead to a testosterone deficiency, resulting in loss of libido, low muscle of mass, mood changes, and of course, erectile problems. There is a term called late-onset hypogonadism, sometimes referred to as age-associated testosterone deficiency, is a condition characterized by low levels of testosterone in older men. This is something every man should pay attention to. And did you know? Testosterone deficiency can be found frequently in diabetics. Diabetes itself is one of the major health challenges of our time, because high blood sugar levels can damage blood vessels and nerves, leading to erectile dysfunction. Furthermore, obesity is often associated with both diabetes and cardiovascular disease. If you're overweight, you don't even realize that. It's directly affecting your hormone levels and blood flow, resulting in the risk of ED. Often obesity is also supplemented by elevated blood pressure and high cholesterol levels, which are important of atherosclerosis, meaning it blocks blood flow to the penis. Now, let's talk about some lifestyle factors. Lifestyle factors also play a significant role in the development of ED in aging males. Smoking and lack of physical activity is a major risk factor. Especially smoking is linked to venous occlusive disorder, meaning that the blood cannot be kept inside the penis and is drained from the penis, results in erectile dysfunction. Similarly, excessive alcohol consumption also contributes to ED. While moderate drinking might not have a significant impact, heavy drinking can lead to nerve damage and hormonal imbalances. Finally, let's not forget the psychological factors. Mental health is just as important as physical health when it comes to sexual function. Stress and anxiety, which can increase with age due to various life pressures, can significantly impact sexual performance. Depression is another factor. Relationship issues and a lack of communication with your partner can also contribute to erectile dysfunction. So what can be done about it? First of all, consider your lifestyle choices. Maintain a healthy weight. Regular physical activity helps maintain a healthy weight and improves blood circulation. Aim for at least 150 minutes of moderate aerobic activity or 75 minutes of vigorous activity per week, along with muscle-strengthening exercises. Eating a balanced diet rich in fruits, vegetables, whole grains, and lean proteins. There has to be a proper diagnosis, looking at the involved factors like hormonal deficiencies, vascular changes, chronic diseases, medications, and psychological issues. Diagnosis involves a thorough medical history, physical examination, and blood tests to measure testosterone levels. A diagnosis is typically confirmed if blood testosterone levels are consistently low and symptoms are present. So, schedule regular visits with your doctor to monitor testosterone levels and overall health. So, educate yourself about the symptoms and choose what treatment options you can avail to get your erections back. Thanks for tuning in. Coming up in our next video, we're going to explain all the treatment options available to fix erectile dysfunction. Whether you're dealing with mild issues or more severe cases, there are solutions out there for you.